Thank you for choosing CBI Health. As you begin your journey in virtual healthcare, we want to ensure that you get the most out of your virtual care and telehealth sessions. In this video, we'll provide some tips to help you prepare for your session. Be sure to watch our other videos to get additional information to help you get started. Preparing for your virtual care and telehealth session. By now, you will likely have received an email from your team at CBI Health with details about your upcoming virtual care and telehealth session. Please confirm your appointment by clicking the Yes button in the invitation email. Choosing a location. There are a few things to keep in mind prior to starting your session. Choose a location that is quiet and private if possible. You might want to pick a private room so other people don't hear your conversation or interrupt you. You also have the option to use wireless headphones depending on the treatment. It's important to choose a room where you will have adequate space around you to complete any exercises your healthcare provider may ask you to do. As a general rule, if you can stretch your arms out and turn around, that should be enough space. A bright space with good lighting would be best. If you choose a room with a window, please close the blinds to ensure you and your healthcare provider can see one another. If there will be another person in the room with you, please let your healthcare provider know at the start of your session. For your security, do not complete your virtual care and telehealth session in a public or unsecure environment. What you need to bring. As you prepare to start your session, please have the following available. Your photo ID. You will need to show your photo ID to your healthcare provider at the start of your session to confirm your identity. Your phone number. In case the video session is disconnected, your healthcare provider will need a phone number to call you back. Location address. Please make note of the address where you will be completing the session. This will only be used in the event of an emergency. Emergency contact. Please be prepared to provide the name and contact information of an emergency contact. Your healthcare provider will ask for this information at the start of your session as a safety measure. Please also ensure your consent form has been signed and provided to your healthcare provider prior to your session. Other things to consider. Your treatment might include exercises and stretches, so you should dress like you're going to the gym. Wear comfortable clothing so that you can easily move around. You might also be asked to use a few common household items, such as a can of food or a chair, to do certain exercises during your session. If any household items are required, your healthcare provider will email you prior to your session so that you can be prepared. How to join your session. Now it's time to join your session. Open the email invite from your team at CBI Health and click on the Join Microsoft Teams Meeting link at the bottom of your screen. If your calendar is linked to your email, you can also open the invitation directly from your calendar. You will be redirected to a welcome screen, giving you the option to download the MS Teams application or join on the web instead. You might see a pop-up window to Open MS Teams. Once you select Open MS Teams, you will be directed to the virtual care and telehealth meeting room. Here, you will have the opportunity to turn on your camera and microphone by clicking the corresponding buttons. We recommend setting your speaker volume to 70% or 20% if you're using headphones. Once you are ready to join your session, click Join Now. You will be placed into a virtual lobby until your healthcare provider adds you to the session. Once added, you will be able to see and interact with your healthcare provider. Your session will now begin. Thank you for watching. If you would like to know more about what to expect during your virtual care and telehealth session, please watch the next video.